colleagues, thank you so much for joining us this morning for this conference dedicated to Ukrainian healthcare. I am NELYA MELNITCHOUK. I'm surgeon at the Brigham and Women's Hospital here in Boston, but also co-founder of an organization called Global Medical Knowledge Alliance. We have been working in the medical space capacity building in Ukraine since 2017. I'm also co-founder of our local Heal Ukraine group, which we formed at Mass General Brigham, Harvard after full-scale invasion, and have been helping Ukraine through that as well. This conference is actually part of UAMed conferences that we had, a part of the series of UAMed conferences that we had, 3 in Ukraine, and our last one is here in the United States at Harvard. And a little bit about UAMed. UAMed is a consortium coalition of multiple organizations and multiple physicians from academic institutions who are all working very hard to help healthcare in Ukraine with capacity building and strengthening systems in Ukraine. Big thank you. This took a while to put together this conference, and big thank you to Jackie HART from Heal Ukraine Group, Jane Unruh from Harvard Scholars at Risk, Timish Holovich from Harvard Ukrainian Research Institute, Eliza Pasal from HUG, Natalia Kovalchuk, Andriy Zinchuk, Taras Makhlei, and our biggest thank you to Alex Domoradsky, who is right there from Razom, who helped us put this together. Without Alex, this would just be in our minds, as we all think big, but sometimes it's harder to put things on the paper. I will turn the microphone back to Jackie HART, who will also say a welcome word from Heal Ukraine Group, and we will start with presentations.
Thank you all for being here. It's nice to see so many faces live and in person. This has been a work in progress for both many months, but also really intense over the last several days to weeks. I want to sort of share with you what I sort of see as the overarching objectives, because it is a very packed schedule with a wide array of topics. But I think the overarching objectives are to reflect on what's worked in terms of American and Ukrainian and Canadian and Ukrainian relationships and collaborations, where the challenges have been, and how we can innovate and create collectively together moving forward. I also hope that we will motivate and inspire new people to get involved, people who have sort of been on the periphery, been curious about what work has been going on between the US and Ukraine, but hopefully we will inspire and motivate folks to get involved. NELYA just ran through many of the thanks. I also want to thank NELYA, who is she's been our visionary, honestly, right from the start. She comes up with ideas and concepts, and she inspires all of us to follow through on them. So NELYA is a special and unique person, and I want to recognize Sergey Melnichuk, who is here as well, who has been a co-founder of GMKA and of HUG. That's really all I have since the thank yous have been made. I wanted to recognize Alex Domoradsky because she really has made every detail of this possible. Also Jarvis Mack, who is out in front, who many of you met, and Olya, who is sitting here with us, who's also made this possible on many levels. So I'll apologize as the American for mispronouncing Ukrainian last names. It's an inherent flaw in my US vocabulary. So without further ado, I'm going to introduce Timish Holowinski. There's my first last name mistake, who is the executive director of the Harvard Ukrainian Research Institute. We also could not have done this without that partnership. I also just want to reiterate our partnership with Harvard Scholars at Risk. Jane Unruh will be here shortly, but Jane has been a partner for the Heal Ukraine Group, which would not have been kicked off if we did not have that particular partnership. So thank you all for being here. Timish.
Thank you, Jackie. Nelia, thank you. As was mentioned, I am Timish Holowinski. I'm the executive director of the Ukrainian Research Institute here at Harvard University, affectionately known as HURI, H-U-R-I, as you can see on our logo. The institute was established in 1973. Its mission at the time was to advance knowledge about Ukraine here and abroad with a focus on Ukrainian history, literature, and language. However, since Ukrainian independence, our mission began to broaden, and especially so since 2019, when we established the Temerte Contemporary Ukraine program. That particular program's focus is to focus on contemporary and social issues in Ukraine, to bring policymakers and scholars together to discuss important issues in Ukraine. And therefore, we feel that it was quite fitting and appropriate for us to act as sponsors of this conference, which looks at the very important issue of current healthcare concerns, medical techniques, and other issues. Therefore, it is my pleasure, on behalf of the Ukrainian Research Institute, to welcome all of you to this conference today, and I wish all of you much success in networking, learning, and sharing information. Thank you very much.
Good morning, everyone. It's a pleasure seeing so many people here who have contributed to and are hoping to contribute to the collaboration between Ukrainian, American, Canadian, European researchers, academicians, clinicians, healthcare workers. My name is Andrei Zinchuk. I'm a pulmonary critical care and sleep doctor. I work at Yale University. I'm a physician scientist. I'm also a founding member of Doctors United for Ukraine, which is an NGO that works in this space, and also a founding member of UA-Med Alliance, which includes a number of academic institutions and nonprofits. And of course, as NELYA and Jackie have mentioned, I am grateful to everyone who participated in making this conference possible. And I also want to highlight contributions of Douglas Davis as well, who has helped create this UA-Med Alliance and helped advertise these